Dr. Keefe, thanks so much for having us out here today. So you've been a customer for now 6 or 7 years,
Yes.
a laser user. Maybe you talk about your first laser, why you bought it, and why you bought the second laser.
Gotcha. So this is actually the first laser. The
Okay,
original,
the Express,
yes.
right?
And I first bought it because I didn't think I'd use it for hard tissue purposes. I was doing a lot of surgery, and I thought it could be a new, better healing, less sutures. So I really saw the value in the soft tissue,
Okay.
but I did not see the value in the hard tissue. So the Express was the more cost-effective option to go with at the time.
Right.
And then once I got it, I started to dabble in some of the hard tissue components that this laser could do.
Mhm.
And then I realized you couldn't put a turbo handpiece. You couldn't put the bigger tips to cut faster to do preps. And so then I talked to my sales rep, and he was like, well, that's what we can do in the iPlus. And I was like, you were right. And so I said, I don't want to lose the one that I have, but I see how much I'm using it, so I just want a second one, and I want to be able to do more with it. So then I ventured into getting the iPlus as well as already having the Express in my
Right.
surgery room.
And you got an Epic X at the same time.
Correct,
as you
to
got
do
the,
for TMJ, for most part TMJ
Mhm.
and whitening treatments.
Okay.
With having an Express and an iPlus, I don't really use my Epic necessarily for all the soft tissue management,
Right.
because I already have two much more capable lasers
For the soft tissue.
for the
right?
soft tissue. My vision originally was to create like a dental hospital. And so where you could get all your needs met under one roof
Mhm.
and not have to be referred out, and also offering the latest in technology and techniques.
Right.
And so push myself through training, CE, going to different events to really be able to offer those services. And then as we've grown, we've been able to implement and add technology more and more. Like I said, this was the most cost-effective way to integrate lasers into my practice.
Right.
And then once I had it, we wanted to do more. So
Right.
then we had the extra capital, so we kept investing in the technology as we went to offer that comprehensive care. We work with a local residency to help them explore technology, especially through a pro bono work with our homeless shelter. We expand and use the technology and help the residents understand and use the technology for complex cases
Right.
on those patients. And so then we slowly build out the office to now we have just the hygiene kind of center of the office. We have minor restorative treatment in another section of the office. And we have complex case management in a third portion of our
Okay.
office. And then our plan is to build out actually like an actual teaching center where you could have CEs or seminars where not just our local community could take part in the complex case management technology, but could expand it to a broader area to help influence the care and technology being utilized in other offices.
Well, you know, from what I've seen, you certainly have the great footprint for that. You mentioned the pro bono work. I was interested in you talking about some of the veterans groups that you work with, some of the indigent homeless population. Maybe you can talk some about what you do there.
Yeah, so it was a small project I started when I was just growing. I always felt it's a need to help those who necessarily don't have the outlets to care.
Right.
And part of the outlet is some of the options aren't affordable. So it started with during cancellations, I'd actually have pre-screened individuals at the shelter
Mm-hmm.
with an initial list of needs. We'd bring them in at random to get exams and x-rays so we could fully treatment plan, and then components of their treatment plan we would work in where I had cancellations in my schedule. We'd use them as schedule fillers. And then it started to grow and get a better routine. Then I started to dedicate one day a month to this project. And then I incorporated it back in my residency where I learned a lot of my dental techniques and case planning. I felt there was a technology that could be infused into the residents' learning.
Mm-hmm.
So now I bring a resident out and one-on-one mentor them in the office. And they get to use all the technology, using the lasers, using digital scanners, using
Really
coding.
hands-on.
And they get to apply complex case management and planning. And then the homeless or veterans that we see in the project, they get all the work done for free, so they don't have to worry about co-pays or out-of-pocket expenses.
You must have some incredible stories about how you've changed people's lives with this program. What are some of the common procedures that you do with the laser now that you may have not been doing before?
Frenectomies, number one, and gingivectomies. As far as restoratively, where you would prep the tooth and be like, well, it's okay.
Yeah.
So I was doing good work, but achieving, what I would see great results or more ideal treatment for patients. Now my patients get the benefit of they have the option, if we need to crown lengthen to get the ideal tooth proportion, it's not even a question if we're doing it, it's just we're doing it with the procedure.
Right.
And so now to deliver that optimal care or that perfect care, it's just built in second nature to we're just doing it.
Do your patients know you're using a laser?
Yeah, we inform them that we will be using a laser, and we inform them that it's going to be the best way. Instead of cold steel and sunshine, which has a lot of healing with it, we have patients who can leave and see the result instantaneously and not actually have to wait to see the result once all the inflammation goes away.
Right.
Patients, they're our best billboard. They walk out, and so the better dentistry that we've been able to do, the happier people leave and the more people that get referred in because of the results that we're delivering. Not is it, did it turn out well? They leave excited about what happened.
When you say patients are your best billboard, we feel the same way about our customers, right? Because nothing sells technology in this type of practice like peer-to-peer referral and so forth. So thank you so much for being part of the BIOLASE
Thank you.
family. I appreciate your time.
Perfect.
Thanks.